How can I prevent UTIs with neurogenic bladder? If you or someone you know has a neurogenic bladder, you might wonder how to keep urinary tract infections at bay. Managing this condition involves understanding how nerve damage affects bladder function and taking steps to reduce infection risks. Neurogenic bladder often results from nerve injuries caused by spinal cord injury, multiple sclerosis, spina bifida, or other neurological issues. These conditions can interfere with normal bladder control, leading to incomplete emptying, urinary retention, and the need for assisted bladder drainage methods like catheterization, which can increase infection risk. The key to preventing urinary tract infections starts with how you manage bladder emptying. The safest method is clean intermittent catheterization, where a sterile catheter is used several times a day to empty the bladder. This approach helps prevent bacteria from lingering in the bladder, which is common with long-term indwelling catheters. If you cannot perform intermittent catheterization, alternatives like suprapubic catheters or triggered reflex voiding may be options, but these carry a higher risk of infection compared to clean intermittent catheterization. Always work with your healthcare provider to choose the best method for your situation. Good hygiene is essential. Always wash your hands thoroughly before and after catheterization, and use a new or properly cleaned catheter each time. Reusing catheters without proper cleaning can introduce bacteria and increase infection chances. Staying well hydrated is another important step. Drinking enough fluids helps flush bacteria out of your urinary system, reducing the chance of infection. However, if you have other health conditions like kidney problems, your doctor might advise a different fluid intake level. Avoid unnecessary use of antibiotics for prevention. Routine antibiotic use is not recommended because it can lead to antibiotic resistance and does not reliably prevent infections. Instead, antibiotics should only be used when you have an active infection. In some cases, your doctor might consider medications like methenamine hippurate, which can help prevent bacteria from growing in the bladder without the risks associated with antibiotics. This medication works by releasing formaldehyde in acidic urine, creating an environment that inhibits bacterial growth. Managing constipation is also crucial. Bowel issues can increase the risk of urinary infections, so maintaining regular bowel movements through diet, fluids, and medications if needed can help lower this risk. While cranberry products are popular for UTI prevention, current research does not support their effectiveness in people with neurogenic bladder, so they are not recommended as a primary prevention method. Regular follow-up with your healthcare provider is vital, especially if you experience frequent UTIs. Recurrent infections might point to issues with your bladder management or underlying health problems that need attention. For postmenopausal women, topical estrogen may help strengthen the lining of the urinary tract and reduce infection risk, but this should be discussed with your doctor. Finally, use catheters only when necessary and for the shortest duration possible. Proper hygiene during catheter use is essential to prevent bacteria from entering the urinary system. Remember, each person's situation is unique, so working closely with your healthcare team to develop a personalized plan is the best way to keep infections at bay and maintain your bladder health. Always seek medical advice tailored to your specific needs and circumstances.